Pregnancy week by week. First trimester. Week 1 to 2. No, there's no baby or embryo in sight. At least not yet, just an anxious egg and a whole bunch of eager sperm at their respective starting gates. But in weeks 1 and 2 of pregnancy, the week of and immediately following your last menstrual period, your body is working hard to gear up for the event that paves the way for baby, the big O, or ovulation. Right now, your uterus has begun preparing for the arrival of a fertilized egg, though you won't know for sure if that egg has successfully matched up with sperm until next month. You ovulated this week, and the moment you've been waiting for has finally arrived. You've conceived, meaning your soon-to-be fetus has started on its miraculous transformation from solitary cell to bouncing baby boy or girl. Once the winning sperm makes its way through the egg's outer layer, the single-cell fertilized egg, or zygote, immediately forms a barrier to keep other sperm out. But your zygote doesn't stay single for long. Within hours, it divides into 2 cells, then 4, and so on, until the growing cluster comprises around 100 cells just a few days after that crucial first meeting between sperm and egg. Some will form the embryo, others the placenta, but for now, it's still just one microscopic ball of cells that's 1/5 of the size of the period at the end of the sentence. Despite its extremely tiny size, no longer than 1 millimeter and no bigger than a poppy seed. Think about that as you eat your morning bagel. Your little embryo is busy setting up house. Placenta and embryo begin forming. While you may have just started to wonder whether you're pregnant, your soon-to-be baby has already found its home. The blastocyst has completed its journey from your fallopian tube to your uterus. Once there, it burrows into your uterine lining and implants, making that unbreakable connection to you that'll last the next 8 months, and a lifetime after that. As soon as that little ball of cells is settled in your uterus, it will undergo the Great Divide, splitting into 2 groups. Half of what's now called the embryo will become your son or daughter, while the other half forms the placenta, your baby's lifeline, which channels nutrients and carries waste away until delivery. At 5 weeks pregnant, your little embryo is still super tiny, measuring about the size of an orange seed. Baby has a tail. So what does your baby look like now? Actually, not unlike a tadpole, with a rudimentary head and a tail. But don't worry, there's no frog in your future. In fact, you're fewer than 8 months away from holding a real prince or princess in your arms. While all this is happening, the HCG hormone levels in your body are now high enough to confirm that you're expecting using a home pregnancy test. Go to the doctor to confirm the good news and figure out your due date. Week 6. When you're 6 weeks pregnant, your baby's crown to rump measurement is anywhere from 1/5 to 1/4 of an inch and growing, making it the size of a nail head or a sweet pea, your little sweet pea. Baby's head takes shape. You might be coping with full-blown pregnancy symptoms, but there's plenty of good news too. The folds of tissue and the prominent bump on top, the head, are developing into your baby's jaw, cheeks and chin, which will eventually become one adorable face. And are those little indentations on both sides of the head the sweet dimples you always hoped your baby would inherit from your mom's side of the family? No, there are canals in the making. Small dots on the face will form the eyes and button nose in a few weeks. Also taking shape this week, your baby's kidneys, liver and lungs, along with his little heart. Week 7. Your baby's approximately 1/4 of an inch in length now, about the size of a blueberry. Sounds pretty tiny still? Consider this for a little perspective. Your baby is 10,000 times bigger now than she was at conception a month ago. New brain cells form rapidly. At 7 weeks pregnant, most of that growth is concentrated in the head, the better to store all those smarts, as new brain cells are generated at the rate of 100 per minute. How's that for a budding genius? Week 8. Your baby is growing at an amazing rate. How's she measuring up this week? At a length of about 1/2 to 3/4 of an inch right now, your little one has graduated from blueberry sized to raspberry sized. Baby's growing fast. Meanwhile, how big baby is has become a bit harder to estimate. Though growth occurs at about the rate of a millimeter a day, it isn't necessarily just in height. Spurts can happen in the arms, legs, back and other parts of that tiny body, meaning big changes are coming every which way in the next few months. Week 9. At 9 weeks pregnant, your little one is now about 1 inch long, the size of a medium green olive, but no martinis, please. The embryo period ends. Would you believe your baby is only an embryo for 1 more week and is already developing into a fetus? The head has straightened out and is more fully developed and the ears are continuing to grow, making baby look more human. Plus, toes are visible, and all of baby's essential organs, like the heart, brain, kidneys, liver and lungs, have begun to develop. The arms and legs in your soon-to-be fetus are also spontaneously moving now that minuscule muscles are beginning to develop, though you won't feel your tiny dancer for at least another month or 2. Week 10. Your baby's growth is fast and furious when you are 10 weeks pregnant. She's nearly 11/2 inches long and the size of a prune, but not nearly as shriveled, even with all the time spent in water. The start of the fetal period. Congratulations! Your baby has officially graduated this week from embryo to fetus. Baby's bones form. Your baby is really taking a human shape now. Bones and cartilage are forming and small indentations on the legs are developing into knees and ankles. The arms, complete with elbows, can flex already. How's that for magical? Still, don't run to the store for a baseball bat just yet. Though your baby's arms are taking shape and getting stronger, each one is still teeny tiny, slightly more than 11/2 inches long now and weighing about 1/4 ounce. Your baby has been pretty busy growing this week. Baby's got fingers, toes and other new features. Hair follicles are forming not just on the crown, but on the rest of the body. And those tiny hands and feet have individual fingers and toes, meaning goodbye to those frog-like webbed hands and feet. Meanwhile, fingernail and toenail beds begin to develop this week. In the next few weeks, the nails themselves will start to grow, so don't forget to add a baby nail clipper to your to-buy list. While you can't tell what baby's sex will be yet, ovaries are developing if it's a girl. And by week 11 of pregnancy, baby has other distinct human characteristics: hands and feet in front of his body, ears nearly in their final shape, open nasal passages on the tip of his tiny nose, a tongue and palate in the mouth, and visible nipples. Week 12. By now your baby weighs a full 1/2 ounce, with a crown to rump length of 2 to 21/4 inches, about the size of a lime. It's hard to believe, especially from the outside, since you're probably barely showing at this point, but your baby has more than doubled in size during the past 3 weeks. Baby's digestive system begins working. This week marks a turning point for your baby. At 12 weeks pregnant, the Herculean task of developing new bodily structures is nearing an end, as most of your baby's systems are fully formed, though there's still plenty of maturing to do. Now comes the maintenance phase, during which your fetus systems continue to evolve for the next 28 weeks and the organs get to work. For one thing, the fetal digestive system is beginning to flex its muscles, literally, as it starts practicing contraction movements, a skill your little peanut will need after birth to push food through the digestive tract. The bone marrow is busy making white blood cells, weapons that will one day help your baby fight infection once she's out of your safe haven and in a regular playgroup. And the pituitary gland at the base of the brain has started producing the hormones that'll enable her to make babies of her own in a few decades or so. Week 13. Besides being as large as a lemon now, that head of his is now about half the size of his crown to rump length. That's one reason why your little one looks more like an alien from outer space at this point. By the time you give birth, his body will catch up, measuring 3/4 of his total size. But don't compare your fetus with the fetus next door. Starting in the next week or so, babies begin growing at different paces, some faster than others, some more slowly, though they all follow the same developmental path. Baby's intestines and vocal cords are developing. What else is going on in there? At 13 weeks pregnant, tiny bones are beginning to form in his arms and legs. Because he can move them in a jerky fashion, he may be able to get his thumb into his mouth soon, a habit that may come in handy for self-soothing when he's a newborn. Your baby's intestines are also in for some big changes. Until recently, they've been growing in a cavity inside the umbilical cord, but they've just moved into their permanent, and more conveniently located, address, in your baby's abdomen. And to serve your growing fetus needs, the placenta is also growing, eventually weighing 1 to 2 pounds at birth. Also developing this week, your baby's vocal cords, the first step toward saying, "I love you, mommy!" and quad. You obviously can't hear him crying or cooing just yet, but you can bet that little voice will get a good workout once he's born. Second trimester in the next video. Subscribe to our YouTube channel about pregnancy. Thank you.